Hi, I'm Tessa, a veteran educator working in the field of special education.
And I'm Kim, mom of two autistic boys and a late diagnosed autistic person myself.
And welcome to Totally Over the Spectrum, where we dive into embracing autism through understanding and support.
Hello, and welcome to episode 11. And we're talking about sexuality and gender identity.
Oh my, that's a mouthful.
Yeah.
That's a very sensitive subject in general. That is a hot topic, sensitive subject. And once we get into this podcast and have, address some of the concerns or questions and information out there, I think people are going to understand how, pardon the pun, diverse this conversation is.
The first thing I want to start with is addressing some misconceptions. Right?
Great place to start.
Hey, we discussed this in a little more detail in episode 8 when we did some myths and facts, where we debunked 10 common misconceptions. But I just want to reiterate it here. One misconception is that autistic people are all asexual, which means they have little or no sexual attraction to others. That is not true. That they don't want romantic relationships, also not true. And they don't understand emotions, also not true. So debunking those 3 misconceptions to start with, I think is a really good place. The fact is that autism doesn't impact sexual development.
Yes. And I think a lot of parents need to be prepared for this because the chronological development in a person and the cognitive development of the person, the discrepancy is always going to be, in most cases, significant. But it's not going to stop that development. And parents need to be prepared for themselves to be able to help their kids deal with this in a very, in a healthy manner.
Yeah, hormones are going to happen.
Yes.
Being autistic doesn't mean that a person is uninterested in sexual relationships, right? They talk about autism being a spectrum. It is not a straight line spectrum, but it is a broad spectrum. So, you're going to have people all over the place with different profiles and all of those kinds of things, right? So not every person is going to be uninterested. People are going to want romantic relationships or sexual relationships. Studies have shown that autistic people have the same sexual desires as neurotypical people. And those studies, of course, are looking at your level 1 autistic people. We're not looking at autistic people that necessarily have comorbidities like intellectual disabilities. Okay, most of these studies are not looking at that. That is not the information that I have.
I agree with you because, these are the people that are able to articulate their wants and needs versus your level 2 or level 3. But it does not mean that they do not exhibit signs and, interests in sexual activities.
Correct. That said, autistic individuals may have challenges with social interactions, which can affect their sexual and romantic relationships. Autistic adolescents, in particular, tend to have less sexual awareness, increased rates of inappropriate sexual behaviors, and are more likely to identify as LGBTQ+.
Yeah, and I think there was a study in the Netherlands that address and a lot of these conversations that we're going to have, these topics that we're going to have. And it was fascinating to read about the percentage of people with autism that are far more sexually diverse than what was understood to be.
Yeah, absolutely. So if we start talking about LGBTQ+, I think it's a great place to start.
Okay.
The scientific literature is a bit all over the place. Generally, there are higher rates of homosexuality, bisexuality, and asexuality in the autistic population. I don't dispute that there is a higher percentage of LGBTQ+ individuals in the autistic community compared to in the general population. I did have an issue with the methodology used in the studies. With my science background, I look at them and sort of critically analyze how the study is done. Sample sizes are really small. They're not representative of the autistic population as a whole. Questions never seem to be geared towards autistic people. Sometimes they were just asking the parents of autistic people, right? Like, and things just could be done better. And I think they should be done better. And I think people deserve to have these studies done and have them done better.
I agree with you because it does. A lot of this information is obtained from the parents on what they observe. What about stuff that they're unable to observe, right? That's done behind closed doors or,
Exactly.
Yeah, I agree with you in regards to how these statistics are obtained.
Yeah. So I think I agree that there's a higher percentage, but I think that percentage might even be a little bit higher because I think maybe some people might be hiding it from their parents, right? It might not be a safe environment or, they might not have explored that because they haven't been given the opportunity to.
Yeah. And also, I think a huge factor that plays into this, into sexuality is, religious and cultural beliefs impact the statistics very, very strongly.
Absolutely. And I think questions also need to be geared towards autistic people. Like, I have a hard time filling out questionnaires. Questions don't make sense to me. A neurotypical person would be like, oh, you're just overthinking it. I'm like, no, I'm just thinking about it. Like, that's how my brain works. I'm thinking about it and I don't understand the question. I don't know what response you're looking for. I don't know how to answer this. Right? And I can give you a really simple example. What's your favorite color?
Green.
Okay. I feel like that is an expected response to that question. Right? But in my mind, I'm going, okay, she likes green, but what kind of green does she like? Like, my idea of green and your idea of green are probably not the same thing, right? Because there is a spectrum of green. Maybe you like lime green. Maybe you don't like lime green. Maybe that's like the one color you don't like. So I find the idea of something being a favorite to be extremely distressing for me because it doesn't make sense. If I say, okay, well, I want to narrow this down so you know exactly what color I really like, I could say that it was like a metallic indigo or something, and you'd have a better idea that that's like a blue purple. We might be on the same page with that. But is that really my favorite color? Well, I like that color, but I'm not going to paint my walls with that color. So is it really my favorite? Is it the one that I like above all other things? And that sort of black and white thinking is really hard to get past because I'm not understanding this question. I don't have a favorite food. I don't have a favorite color. I don't have a favorite anything. There's no one thing that I like more than all other things. So I have the generic response, right? I know what I'm supposed to say, but is it a truthful thing? I don't feel like it is. So when you're writing questions for autistic people, maybe you should have an autistic person helping you write those questions.
Yeah, they have to be very specific so that they're able to answer those questions meaningfully to them and, accurately to them.
And I know that people are going to say, well, sexual orientation is sort of a less abstract concept than a favorite because it's biological. Sure, yes, but feelings can be really difficult for autistic people to describe, right? So I have a little short scientific info dump incoming.
Okay.
All for one.
You do that.
All right. I love these words. Alexithymia, fantastic word, feels good in your mouth. What awesome word. Is a neuropsychological phenomenon that is characterized by having difficulties in describing, expressing, and even recognizing your own emotions. It affects anywhere from 35 to 85% of the autistic population. Studies, of course, all over the place, but generally agreed that the neurotypical population, it's around 5 to 10%. So It is much higher in the autistic population. Now,
and therefore they say it's a phenomenon for a reason.
Right. So that doesn't mean that if an autistic person says, I'm queer, you shouldn't take their word for it. Like, you shouldn't say, oh, you're autistic, you don't know how you feel. Don't infantilize autistic people. No, it just means, okay, I have alexithymia. Weird thing, right? So I cannot describe to you how sad feels. I can't describe that.
You can recognize it.
I can recognize it. I know what it is. I can recognize it in someone else, but I can't begin to describe to you how that feels in my body. Can't do it. Okay. I don't have words for that. I only found that out when I was having my diagnostic test, when they were doing my assessment, and they said, describe sad for me. And I'm like, that it shouldn't be that hard. How can I not? I was really upset with myself because the only word that came to my mind was wet. And I didn't say it because I thought it was stupid. So I just didn't have an answer. I just didn't have an answer for that.
And I think, but you've also got to give yourself a little bit of a break over there, because I think emotions in general are very difficult to describe because they are unique to each and every person, right? Emotions, I believe, are also a spectrum, right? So happy to one person is not exactly happy, the same type of happy to another person. It's a generalized term that people can say, yes, we kind of know what it is, but exactly how each person feels happiness is going to be different.
Exactly that. So, I mean, if you are autistic and you need time to think about your sexual orientation, like that's okay. But, oftentimes that's not the issue. Lots of times autistic kids know out the gate, really young, that they are attracted to other people. And it's only society telling them that that's not okay that gets them to shut that down. Mm-hmm. Right? And I think that goes for a lot of queer people too.
I agree with you. I think a society and the language around that and acceptance needs to change even more than it already has. But we're on a positive path. It's just that it needs to be, it needs to be better.
Yeah, I think it needs to be the norm. I think it just needs to be, just accepted. I don't know why it bothers everybody else, right? It's got nothing to do with everybody else.
Yeah, as long as you're not hurting anybody else,
right?
Who you are and what makes you feel good should be embraced.
Yeah, so I think that's a really important topic. So the next thing I want to talk about is, so recognizing and identifying sexual needs is difficult, right? It can be difficult. So if it is difficult to communicate your sexual needs, you can feel misunderstood. You can feel isolated. And that's especially true for LGBTQ plus autistic people, because you're discriminated against for being autistic. That is a thing that happens. And then on top of that, also for your sexual orientation. So you've got it from both sides. And then on top of that, if you're also a person of color.
Yeah, it is. Yeah, it's extremely difficult to navigate, right? And it almost feels that no matter which way you look or which way you go, there are so many barriers for you to overcome that you see a lot of people with autism feel a sense of despair.
Yeah, anxiety and depression is really high in the autistic population.
I agree.
Because you keep getting told that you're wrong. That everything about you is wrong. How you think is wrong. How you move is wrong. What you like is wrong, right? And that's hard. That is a hard place to be.
It is.
And then sexuality on top of that. That's for some people, you just can't navigate it.
I think it's difficult for anybody to navigate, leave alone a person that needs more explicit reasoning to navigate that.
So the best place to start with all of this is education.
I think that's a common thread in everything that we talk about, is educate yourself on it. Become an expert on your child and become an expert parent in that specific area. It's a lot of work. Yes, we're not denying that. Does it seem sometimes overwhelming?
Often.
Yes, it is. But going back to our parenting tips discussion podcast, be patient, right? Be patient. Just take this one step at a time and use your community, use your support, use the networks in order to achieve these goals.
Absolutely. It is really very important to educate autistic adolescents and adults about sexual relationships, sexual orientation, and gender identity. And generally speaking, the school system does not educate in a way that is meaningful to autistic people.
The school systems, I believe, have a lot of challenges to that surround sex education, because now they certainly have to navigate cultural and religious beliefs in there, right? And they've done a great job in providing parents the opportunity to have their children either be part of that discussion in a educational environment or opt out of it, so that their parents or their religious teachers can help navigate that journey for them.
I think that if the school system is not providing it in a meaningful way, you're left with self-education, right? So learning about your own specific desires, learning about your own preferences. Like if your partner can't know what you like if you don't know what you like, right? And acceptance of your sexuality, whatever it is. Right. So I think that self-education piece for when it's possible for people is super important. I think open communication is really important. If you are in a relationship with someone, or you're, starting a relationship with someone, talking about things before sexual activity, during, after, whatever works for you as a couple, and don't just assume that things are understood with your partner. Right? If you are neurotypical dating someone who is autistic, don't just assume that they're going to know what's going on. Like you're going to have to talk about it.
Yeah. It takes more effort. But I think, if neurotypical couples applied the same effort, I think relationships would be a lot more successful.
100% agree.
So most of our discussion so far is appealing to those level 1,
Yes.
right? So we'll go into maybe a little bit later, or dive into, for our level 2 and 3 on what is appropriate and what is not.
Yeah, we will definitely get to that. Knowing that there's often comorbidities with intellectual disabilities and that sort of thing. Under this umbrella of open communication, it's really important to understand consent. And that can be a really difficult topic, right? Because missing out on social cues and not understanding them, you really have to give people specific examples and help them to understand. Social cues can be confusing. Not everyone understands them in the same way. So you need to be really clear. It's important to mention that autistic individuals are at a higher risk to be sexually victimized. Because of a lack of education, experience, and because of those social difficulties.
Yep.
Autistic girls are 3 times more likely to be a victim of coercive sexual exploitation.
Yeah, that is, and from all the statistics that I've been reading, it is, those numbers are scary.
Yes.
And as a parent of a person that is autistic, it must be scary for them. Right?
Yeah, absolutely.
But this is where educating yourself and educating your child is absolutely crucial, because now it becomes their safety and well-being.
So as a parent, help educate your adolescent. Talk about their thoughts. Maybe they have a certain person that they think about often. Talk about how their body is feeling. And yeah, we talked about that can be difficult, but give them the opportunity to think about it and talk about it later. Give them that processing time, right? But if you don't ask the question, they're never going to stop to think about it. Talk about how they act around the person that they're interested in, what's appropriate, what isn't. You can use social stories. You could practice asking someone out on a date, right? You can model appropriate language, behavior, like repeatedly asking someone who has said no is not okay. Even if they've said no in like a really friendly kind of way, repeatedly asking them is not okay. Following someone around is not okay. Teach them how to handle rejection and without becoming angry or losing your self-esteem, right? Like model that, talk about that, role play that, give them concrete examples of how that might look.
Yeah, that's because in doing so, you're creating, if you do that multiple times, you're creating, that resilience in emotional resilience and intelligence, and you're slowly starting to make it the norm for them, right? So when it actually happens, it's not going to be such a huge shock to their system.
You can make a script for this, right? And you can practice the script, and that's okay.
And you're going to have to just say, this is a generalized script. Each person is going to say it differently. It's going to sound differently. You're going to hear it differently. And, be explicit when you're describing situations to them as much as possible.
Absolutely. You also need to talk about contraception. You need to talk about condoms. You need to talk about STIs. Autistic individuals tend to be very trusting.
Yes, they are.
Right? So give them information about how they can be deceived, self-advocate, and to be safe.
And also teach them that when they feel that they're in an unsafe situation, what they need to do and how they need to respond. And if something unfortunate happens, such as a rape, what do they need to do afterwards, right? You have to consider all scenarios, as scary as they are, as dark as they are. You're going to have to educate them in regards to all of this.
I think it's also important to let them know that they don't have to be dating or they don't have to have sex if they don't want to. That's okay too.
Yeah,
right. It's peer pressure is out there. You give them examples. Be clear about how that might look. If someone says you have to perform a sexual act, or they won't like you, or no one will like you, let them know that the autistic sexual experience is valid, even though it might look different. And that they do not have to conform to the neurotypical societal expectations that are out there.
Absolutely. And I think a lot of parents are going to go, oh my God, that's like a really difficult conversation to have, because, what if they start, as a neurotypical person, our reactions are going to be, emotion based. But for a person with autism, it's just factual to them. You're giving them the facts. They're not going to look at you and go, oh, you did that and oh my gosh, no. They're going to take it as, oh, thank you for giving me that information. Now I'm able to process that information. And now I have a reference point in which I can use when navigating through society.
If you want your kids to be open with you, you need to be a little bit open with them.
Yeah.
Right? It's really important to encourage and teach self-acceptance, self-confidence. If you can't accept them for who they are, how do you expect anyone else to?
Yeah, absolutely. And mostly, how are they going to accept themselves for who they are?
And self-acceptance also promotes acceptance of other people, which helps when understanding boundaries and consent.
Absolutely. That is a huge part of this topic.
So the next part I wanted to get into was discussing autistic traits, because sometimes they can influence sexual relationships, right? Like social skills, which we were talking about. We know that developing and maintaining friendships can be very difficult for autistic people. And you add in those layers of romance and sexuality, and that can just be completely overwhelming.
Oh, it is a cocktail for disaster in best case scenarios.
So there can be difficulty understanding nonverbal or subtle interactional cues, like flirting. I was on a date and didn't know it. I didn't know it was a date. Like, people can go out for lunch together and it not be a date. So when did it become a date? I didn't have a reference point for that. I missed it, okay, as an adult. So I giggle at me, but it's true. So how are you supposed to know what's going on if you can't pick up those cues?
That's when you've got those self-advocacy skills come into play, and just asking, right? And just saying it's okay to ask a question.
Yeah, you need to be upfront. And I know maybe that's not very sexy for people to be upfront. They sort of want to see that rom-com where you see a person across a crowded room and your eyes lock. Well, eye contact is difficult for autistic people, so I'm so sorry. That's
not going to happen. That's a whole different rom-com.
Yeah, so that's not happening. So sorry, right? If that's your romantic ideal, this is not for you. We also have sensory sensitivities, right? So like eye contact, that can be extremely overwhelming, right? That's generally people think that other people are paying attention if they're making eye contact, right? And if they don't make eye contact, it means they're hiding something, right? It's a sign of guilt, like you've done something wrong. And it's also considered a sign of intimacy, that prolonged gaze, right? So I even read that it makes sex more exciting. this is going to look different for autistic people, and that's okay.
Yep, absolutely.
You could also have, like hyposensitivity, like an underreactive response to sensory stimuli. So if you're underreactive to touch, it might make becoming aroused more difficult.
Or it could be the opposite, where you are hyper and arousal lasts a very short period of time. And for those, level 1 that are listening to this conversation, guess what? It happens with neurotypical people. So please don't think that there is,
there's nothing wrong with you.
Nothing wrong. Yeah, absolutely. So
being underreactive to touch and being, take longer to get aroused, that sort of thing, that can be difficult for the partner as well, because they feel like you're not finding me attractive because this should have happened by now, right?
Yeah. And that's where the open communication piece comes into place, right? And just, letting them know and, and what you need from it in order to be able to, to make this a successful relationship.
And with hypersensitivity, when you're very reactive to sensory stimuli, light touch can feel very unpleasant, right? So you might not like being touched lightly at all, or how a person smells can be too much. Right? So maybe, someone's wearing a cologne or a perfume or something. You're like, no, that's a no-go for me.
That's sensory overload
now.
Can't
handle it. Even the person breathing on you can be too much, right? So you just have to have that open communication and find out what works and what doesn't. And it's not like you cannot work around these things if both partners are willing to do that.
Yeah, and are committed to the relationship. Absolutely. And everything that we're discussing happens in regular neurotypical relationships.
I think the intensity is a little different, though.
Yes, it is. But people experience the same, scenarios and situations. So please, don't think that there's anything wrong with you or you're that different. No, this happens in neurotypical people as well.
Absolutely. Autistic people might also have motor control and coordination difficulties. So you might need to take a little more practical approach to your physical ability. Like proprioception can be low, right? And that's knowing where your body is in space. So,
or being hyperflexed.
Hyperflexible, right? That doesn't mean that skills can't be learned, right? It might take time. It might take some practice.
Yep. And you take the initiative of acquiring those skills.
And so I want to reiterate that just because an autistic person has social difficulties and sensory sensitivities or motor control issues doesn't mean that they can't have meaningful, healthy relationships.
I agree with you. It just looks and feels a little bit different.
Yeah.
Amazing nonetheless.
It just means that they're going to need understanding both of themselves and from their partner, and then find what works for them together.
I agree with you on that point.
So now we will talk about what about when the autistic individual has an intellectual disability.
This is when parents have to educate themselves on making certain decisions for their child. And I think this is a big component where, as an educator, what is appropriate and what is not needs to be clearly defined, and it needs to be followed through. Right. I'm going to pick a sensitive subject and go masturbation, right? You're not going to prevent your child from exploring and engaging in such an act. You're not. So what you can do is give them the tools and teach them where it is appropriate and where it is not. Give them the opportunity to do that, but do that in a place where it is safe and appropriate. For example, it is safe and appropriate to do that in your bedroom, and it is safe and appropriate to do that maybe in your washroom. These are just two examples. Each family is going to come up with their own rules based on what is appropriate for them, for their family dynamics, for their religion, for their culture. All of these factors need to be taken into place. And you also have to teach them where it is not appropriate. And you're going to have to follow through in that. it is not appropriate to masturbate in public, because once these children and and teenagers grow up to be adults, the consequences also grow with that. And society is not going to be as forgiving. So please invest and take the time and the effort to implement what is safe and necessary for them when you can do that. And, unfortunately, when I talk about the education system, as an educator, we do have to sometimes, educate the parents about what their children are doing in a setting, such as a school setting, that is not appropriate. And we need parents and educators and administrators to all be on the same page in regards to what is appropriate and what is not. And this is a parent-led conversation.
People need to remember that individuals with intellectual disabilities still have sexual urges.
Yep.
That doesn't go away. And masturbation can be healthy and beneficial. You can let your child know that it's a healthy part of sexuality. It's completely natural. But again, only in a private place, like you said. There's also this great book that I found called Masturbation, Autism, and Learning Disabilities. We call them intellectual disabilities. This book is from the UK. And a guide for parents and professionals by Mel Gadd. I will put a link for this in the description so nobody has to write this down. She is a youth and community worker and a registered public health practitioner, and also the manager and director of the sex education company located in Wales, UK. I do have a few highlights from this book. I have quite a few highlights from the book. I found this so good. I was like, I want to share all of this.
Yeah, I mean, the sad thing is that the UK system and the Australian system, their research and is almost, light years ahead of us. It is, I'm so sad to say that, but they have got so much. They've got such a wall of knowledge and a wealth of knowledge that please just don't look in Canadian sites, but also look at other countries that have been, tracking data and have invested in research for a lot longer period of time.
Absolutely. So I am going to talk about this book a little bit because I was so happy to find it. There are a lot of healthy benefits to masturbation, a lot of them, right?
Yes,
and this is for everybody, but especially when we're talking about people with intellectual disabilities. So I'm going to fly through them a little bit quickly because I'm also excited about finding this book. So, okay, it can relieve sexual frustration and feel pleasurable. When one has the urge to have sex, masturbation can relieve that urge, allowing for a person to make choices that are not solely driven by sexual desire alone, right? So we're going to decrease those inappropriate behaviors that we might see. It familiarizes us with our own genitals. So looking and touching can help us detect unusual changes, such as a lump. And if no one else is checking your body parts, like a personal care worker or whatever, something unusual could go undetected. It allows people to safely explore their own sexual pleasure and discover what feels good for them. And if they have a sexual partner, they can share what they've learned and leading to more mutually enjoyable sex. Mm-hmm. All good. Pleasures such as an orgasm can reduce the experience of pain, and it relieves the effects of migraines and menstrual pain. Didn't know. Masturbation can be a pleasurable sexual experience. Orgasms can help with sleep due to the release of hormones oxytocin and endorphins, which can help you feel relaxed.
Yeah, absolutely.
Those hormones can also reduce the feeling of stress and anxiety. All great things. Can reduce the incidence of prostate cancer in men. Also didn't know that. Interesting fact to me. It is a safe sexual practice.
And I think we need to emphasize on the safe sexual practice and where it is safe to do so and where it is not.
Right. And like you said, that's going to be different for every person and every family and that sort of thing. But yeah, public place is not okay.
Yep.
Sexual frustration can add to or trigger behavioral problems. And the opportunity to masturbate can make a person feel calmer and happier. Now, what is really great about this book is that she also talks about some of the harmful aspects of masturbation.
Yes, because, it can go to the other extreme.
It
Right?
absolutely can. So the first thing she says, public place is illegal, right?
Yep.
You could offend, upset someone, and any mutual masturbation must occur between consenting adults with whom it is legal to have a sexual relationship with.
Yes.
Yes.
That becomes that it is not becomes, it is a very gray area when you're dealing with a person with an intellectual disability.
Yeah, it is.
Right? Just because they're of a chronological age of consent doesn't mean that they are of a cognizant age of consent. So you've got these are the protective factors that parents need to put into place now go to a whole new different level.
Yes.
So
And people can be taken advantage of, like we've discussed.
absolutely.
Yeah. If you masturbate too roughly or with inappropriate objects, it could cause trauma or infection to the genitals or other body parts. So, you can't just say, okay, yeah, they're going to go take care of that and they're going to know what to do. No, you still need to.
Explicit
Yes.
instructions or directions, or there like this there's books available to do that you can
Yes.
sit down and discover.
I have no affiliation with this person. I just happened to find this book. So, I have no investment in it except that I thought it was really well done. We also need to talk about basic hygiene, right? Keeping parts clean, and any toys that you've used have to be properly cleaned. So, that's also an element that needs to be taught. When someone is masturbating, they know what feels good for themselves, but they might have difficulty imparting those feelings to a sexual partner, right? So that comes back to our open communication discussion.
Yep.
Inappropriate times, or too frequently, or for too long, or inappropriate places such as the workplace or school, right? That's going to interrupt your daily life.
And the impact that has on other people, it also magnifies how people look at people with autism when those situations do occur, right? It taints people with autism who do things appropriately negatively, and then it sets everybody back, in acceptance in the community.
It does. And the other part of that, which is the last point that she gets to, is that if you're not following the social rules for masturbation, like public places, it can identify the person as being a vulnerable person and make them more of a target for abuse.
Yep.
The last point that I'm going to get to that she said, which I also think is really important, is that sometimes it is not masturbation. That's not what's happening. Right? So she said that she's had a lot of questions from teachers and educational assistants over the years about students touching or rubbing their genitals through their clothes, and that can often be mistaken for masturbation when something else is actually going on. And I will quickly go through what these are. Sensory seeking, yeast infection, pinworms, gross, urinary tract infection, sexually transmitted infection, ballantitis, which I didn't know what that was. It's a skin irritation on the head of the penis, which can be caused by a buildup of smegma under the foreskin. Inadequate personal hygiene, tight underwear or clothing, right? You need to make sure that the size is correct for the person, and physical trauma. So don't just assume that this is sexual because someone has their hands on their pants.
Yeah. It also, you've got to be able to say, okay, if it's not this and it's not this and this, and this is a pleasure seeking, behavior that results in, a releasing of climaxing, then that is a masturbation process. So, and that is a huge no-no in public.
Yeah. So highly recommend this book. I think this was fantastic. And again, I'll put it in the description for everyone to find. All right. So we have discussed sexuality, and the other part of this conversation is gender.
That's where a lot of people get mixed up. They put sexuality and gender in the same category.
Yeah.
And I think people have to learn to separate the two because they're very, very different.
So the definition from the Canadian Institutes of Health Research, because I like to have all my
Yes.
definitions in a row. Yeah.
Absolutely.
We have sex and gender, often used interchangeably. despite having different meanings. So sex refers to a set of biological attributes in humans and animals.
Yep.
Right? I'm going to blast through this definition in case people
Absolutely.
Okay. It is primarily associated with physical and physiological features, including chromosomes, gene expression, hormone levels and function, reproductive sexual anatomy. Sex is usually categorized as male or female, but there is variation in biological attributes that comprise sex and how those attributes are expressed. So in a nutshell, sex refers to biology.
Yes.
Okay. Gender refers to the socially constructed roles, behaviors, expressions, and identities of girls, women, boys, men, and gender diverse people.
Yes. So on a form, when they ask you what, sex you are, it is based on body parts, genetics and everything. It's male or female. Where gender can be confusing because people can identify in a different manner but not have the sexual components of what you were born as.
It gets to be a slippery slope there, right? So I think just as a sort of basic understanding, sex is biology, gender is a social construct. Okay. Gender identity is not confined to binary. It's not static. And it exists along a continuum, and it can change over time, right? There's a lot of diversity in how individuals and groups understand, experience, and express gender through the roles they take on, the expectations placed on them, and the relations with others, and the complex ways that gender is institutionalized in society. Okay, so all of that said, there is a higher prevalence rate of gender dysphoria in the autistic population.
Okay.
So I think that's why we're talking about this today. So gender dysphoria describes the distress or the discomfort that someone experiences when their biological sex doesn't align with their gender identity.
Mm-hmm. Well said, Kim.
So there seems to be a connection between autism, sexual orientation, and gender identity, but nobody really knows why.
I agree with that because from all of the research that I have been reading, I tend to go outside of Canada to look at all of this because, they've been, following, some of these studies for a long period of time, several decades, right? And in the Netherlands, they say 15% of autistic adults, present as, have a gender identity as trans or non-binary.
Yeah. So
does that align with some of the research that you're saying?
Absolutely does. And that doesn't mean that autism causes gender confusion. And it's actually, many people report that the opposite is true, that autism actually helps with gender clarity, right? So the higher rates of gender dysphoria in autism could be related to the higher rates of recognition rather than the actual prevalence rates.
Okay.
Right? Does that make sense?
That makes sense to me.
So why is this an important topic? Well, for mental health and well-being, right? For understanding and support. Some autistic people identify their own genders at a young age, and that could include transgender, non-binary, genderqueer, but that they don't have this self-acceptance for a long time because they're taught that gender is only binary, and that they might not even have the language to describe how they recognize themselves.
Yeah. So once again, having that open communication part is going to be crucial too.
Anxiety is already present in about 40% of the adolescent autistic population. That is incredibly high. And then as an autistic person, especially an adolescent who's struggling with neurotypical social norms as well as gender identity, is at a very high risk of anxiety and depression.
Yeah. And all of this, the case studies that I've read, and, it's the huge component, as you say, is the social experience, right? It contributes to people with autism, having the anxiety to increase and depression to increase with this.
So I really think that autistic people deserve to have specialized mental health care, right? You need gender clinic healthcare clinicians who are trained on working with autistic patients and, make appropriate adaptations to the clinical setting.
That would be in a utopic society over here, Kim. I think our mental health system is just overwhelmed right now, and I think COVID was a huge factor in impacting that. I would like to see more on that, and if we can get a conversation going and get people to, talk a bit more about it and, reach out to their professional providers, healthcare providers, and see if we can, build something a little bit better on that.
Really, I think all healthcare providers and educators should be using affirming and accepting language for all sexual orientations and for all gender identities.
That would be great.
I'd
love
hope
to see that. Yep. What's next on your hit list?
What's next? I think that is a good place to end today.
Okay. Well, this is a very diverse conversation that we've had, and I think to me, what this, the links that I make with it is when it comes to gender and sexuality, a lot of people, autistic people, create a lot of masking abilities, which I find is strongest when it comes to gender identity and sexuality. And it is a skill that I came across as what people with autism have, developed very, very early on in order to cope in society. So I thought that it would be an excellent subject to discuss in our next podcast, is masking.
Yeah, absolutely. I can give a lot of personal references to that one.
Okay, so we've got our next topic laid out, and we hope to see you there.
We'll see you soon. Thanks for tuning in. If you know someone who might find this episode helpful, feel free to share. Also, check out our website and socials linked in the description.